Thank you very much. It's a pleasure to be on this show. And actually, I think the predictions are quite timely with respect to the fact that we are beginning to see an upward evolution of the COVID pandemic in the region. So, and I think it's something that every government and Ministry of Health should take seriously. And if you look at the report clearly, it states that WHO country office and the Ministries of Health will be using results of the study to inform their response strategies, which I think is very timely and welcome. So far, I think right from the beginning, as we have followed up closely, we've seen that African member states have taken proactive measures right from the beginning, before the first case arrived on the continent, to ensure that measures are put in place, to ensure that points of entry screening at every airport is done. And that is why most of the cases you will see at the beginning on the continent were actually imported cases. That means the surveillance at the points of entry were really, really effective in detecting the cases. And the result is what we see so far in terms of the gradual evolution that has not been as rapid as we have seen elsewhere. So we give credit to every member state for that proactiveness in ensuring that imported cases were detected at the point of entry. Absolutely, the existence of HIV and just like any other disease, is a source of concern and worry for all of us. First and foremost, just to be clear that there is no clear evidence of HIV status being a factor of severity for COVID-19. But however, something that we need to keep at the back of our minds is that as we are currently seeing in other places, the potential of COVID-19 cases overwhelming health systems could cause disruption of services. And of course, as you know, the HIV, tuberculosis, and malaria, which you have mentioned, are high burden on the continent. And disruption of services of any kind would actually lead to increase in the number of cases or severity of these other diseases. So it's a major concern for all of us at the moment, and which, of course, I think we are all working head on to battle this potential threat and challenge to the health system. Young people can get infected. They can be potential transmitters. So we should have a word of caution there that young people are only protected with respect to the severity and the manifestation of the disease. So we need to be careful that young people could actually equally transmit this to those who might be more vulnerable. While it might be protective with respect to the severity and the overall outcome, which is death, but caution on the side of the fact that they could also transmit the COVID-19.